The Dobutamine stress echocardiogram, or DSE, is a crucial diagnostic tool used to assess aortic stenosis, particularly in cases where traditional assessments may not provide a clear picture. By mimicking the effects of exercise, DSE helps evaluate the severity of aortic stenosis and guides treatment decisions. Dobutamine is a synthetic catecholamine that plays a vital role in the DSE by increasing myocardial contractility and heart rate. It stimulates the beta-1 adrenergic receptors in the heart, leading to an increase in the strength of heart contractions. This effect, known as an inotropic effect, results in increased stroke volume and cardiac output, which simulates the conditions of physical exercise. As the dose of dobutamine is gradually increased, it also raises the heart rate, further mimicking the effects of exercise. This increased workload on the heart raises the myocardial oxygen demand, effectively stressing the heart as it would be during physical exertion. As the heart's workload increases during DSE, the test helps assess how the aortic valve responds to this increased demand. Several key parameters are monitored, including the aortic valve area, or AVA, which is measured both at rest and during stress. In cases of severe aortic stenosis, the AVA is typically less than 1 square centimeter and does not increase significantly with stress. The mean pressure gradient across the aortic valve is also measured, and a significant increase in this gradient during stress suggests severe aortic stenosis. Additionally, Doppler echocardiography is used to measure the flow velocity through the narrowed valve, with higher velocities during stress indicating more severe stenosis. One of the key roles of DSE is to differentiate between true severe aortic stenosis and pseudo-severe aortic stenosis. In true severe as, the aortic valve is critically narrowed, and despite the increased contractility induced by dobutamine, the valve area does not increase significantly. The pressure gradient across the valve rises markedly during stress, confirming severe obstruction. In contrast, in pseudo-severe AS, the valve may appear stenotic due to low cardiac output, often from reduced left ventricular function, but the stenosis is not truly severe. With dobutamine, an increase in cardiac output leads to a significant increase in valve area, and the pressure gradient does not increase as much, suggesting that the stenosis is less severe than initially thought. DSE is also valuable in assessing left ventricular function, particularly the presence of contractile reserve, which refers to the heart's ability to increase stroke volume by at least 20% with dobutamine. In patients with aortic stenosis and reduced ejection fraction, the presence of contractile reserve is a positive prognostic indicator, suggesting that the myocardium can respond to increased workload and that the patient may benefit from aortic valve replacement. Conversely, if there is no significant increase in stroke volume during DSE, this indicates a lack of contractile reserve, often associated with worse outcomes and a higher surgical risk. During the DSE, continuous echocardiographic imaging is performed using 2D and Doppler echocardiography. These techniques allow clinicians to visualize the aortic valve and assess its function in real time. Doppler echocardiography is particularly useful for measuring flow velocities and pressure gradients across the valve, while 2D imaging provides detailed views of the valve's structure and motion. Comparing the echocardiogram images and Doppler measurements taken at rest with those taken during peak dobutamine infusion allows for a thorough assessment of how the heart and aortic valve respond to stress. In summary, the dobutamine stress echocardiogram is an effective diagnostic tool for evaluating aortic stenosis, especially in cases where the severity of the condition is uncertain. By increasing myocardial contractility and heart rate, dobutamine helps reveal the functional impact of aortic stenosis under stress conditions. This allows for a more accurate assessment of the aortic valve area, pressure gradients, and left ventricular function, providing crucial information for guiding treatment decisions, including the need for aortic valve replacement.